In a totalitarian regime, when the policies are not working, the leaders blame compliance. And the lever they pull is more and more control over the people. And of course, with a debatable policy, no amount of control will make it work. And so to the pandemic. We were told, really well done everyone for getting the case numbers down through our actions in the first lockdown. Well done everyone, bravo. Ignoring the fact that a seasonal virus, like COVID-19, comes down in the summer months anyway. And we're now being blamed for a rise in cases in the winter months. Except that in seasonal viruses, like this one, rates dip in the summer and they rise, wait for it, in the winter. Who knew? So whisper it. Perhaps it's not all our fault. Now, hospital capacity, as I've always said, is a red line for me. And it's clear that policymakers feel they need to do something. And I just don't see an alternative to the current measures. But indulging in a blame game for what is a complex scientific question is at best unfair and at worst plain wrong. Please don't tell me that there are 67 million COVIDiots in this country. One journalist yesterday at the government's press conference asked the health secretary whether people's behaviour is responsible for this, implying that it's all our fault. How dare they use the word behaviour? We are not in year 3 of primary school, but that's how many in the media view us. Now, it's obviously clear that having a mass gathering or an all-night rave is completely unacceptable, and frankly, I'm too old for those. I wouldn't know what to wear. But we are now being shamed for chatting to someone outside at a safe distance, sipping a coffee alone on a bench, or going for a brisk walk with a pal in an empty park. I personally think the compliance question has been overcooked and oversold. This is a wretched and highly infectious virus. We all hate it, and it's a huge problem and a threat to our beloved health service. But to blame, vilify and berate the public, treating them like naughty school children, is wrong and it's offensive. Because this is a British public who, in the vast majority of cases, have followed the guidelines for 10 solid months. They've paid with their freedoms. They've paid with their mental health. And in many cases, they've paid with their physical health via missed appointments and undiagnosed other illnesses. And they've paid literally, particularly the 3 million excluded, through lost income. Millions have paid with their businesses and their jobs. Some have paid with their homes. People have paid with their marriages. And our kids, of course, have paid with their education and their future. And many, many have tragically paid with their lives. As the figures from the ONS illustrate today, the non-COVID death toll will sadly dwarf that one of the COVID death toll. Now remember, poverty kills, and we have baked poverty in the system for years to come. So follow the rules, 1,000,000%. That's always been my message. But also, let's trust the public. I trust you. Is that wrong? Is that a mistake? I've always thought that if you trust someone, you go a long way to making them trustworthy. And if you treat people like children, they're more likely to behave as such. So it's one last push as the vaccine comes to the rescue. And this lockdown will likely be the last. An overwhelmed NHS is just not an option. So let's work together and not against each other. Let's win this by engaging hearts and minds. And stop treating us like children and stop playing the blame game. This is Talk Radio.